Welcome to The Explainer. Today, we're diving into a really fascinating study that uncovered a pretty startling pattern in England's health data. Let's start with a number, 25,312. Between 2003 and 2009, that's how many major leg amputations were performed on people aged 50 to 84 in England. And that number leads to a crucial question, right? Is the risk of something so serious the same for everybody, no matter where they live? Well, that's exactly what researchers from Liverpool wanted to find out, and it kicked off a massive investigation into the data.
Okay, so let's get into it. The investigation really began with this hypothesis, this idea that geography, where you live in England, might play a much bigger role in all of this than anyone really thought. So what they did was dig into 6 years of anonymous hospital records. Their goal was pretty simple, really. First, just see if there were any regional differences in amputation rates. And second, try to figure out if things we already know are risk factors, social deprivation or certain diseases, could explain any patterns they found. And they looked at a huge amount of data spanning that full 6-year period. You do that to make sure that what you're seeing isn't just a fluke or a one-off bad year. It makes the findings much, much more robust.
So how do you even begin to tackle a question this big? Well, you have to follow the data trail.
And the data detectives here had a really powerful tool to work with, the Hospital Episode Statistics Database. Just think of it like a giant health ledger for the entire country. It captures millions upon millions of patient records from every hospital encounter in England. They specifically focused on the age group that's most at risk for this kind of amputation, usually because of artery disease. And for these patients, they looked for all those key risk factors in their records, things like their age, sex, social deprivation, and whether they had diabetes, heart disease, or were a smoker. So the first step in the investigation was to split the map of England into 3 distinct zones: the North, the Midlands, and the South.
Okay, let's move on to the results, because this is where the story really starts to build. And what they found, well, it was incredibly clear.
And this chart just illustrates the core finding perfectly. The rate of amputation was significantly higher in the North compared to the Midlands and the South. I mean, just look at those numbers. It wasn't even close.
The researchers' own conclusion was stark and totally unambiguous. They confirmed there is a major north-south divide, and not just for amputations, but for revascularization too. That's the very procedure meant to prevent limb loss in the first place.
But this is where the mystery really starts to deepen. The data detectives had to know, was this gap just a reflection of other health problems? Maybe higher rates of poverty or disease in the North?
Now, what's really interesting here is how this next part complicates the entire story. Okay, so even after the researchers statistically removed the effects of age, sex, deprivation, and major diseases, people in the North still had 22% higher odds of having an amputation. That's a huge difference that the usual suspects just couldn't explain. So the crucial point here is that while we know those other health factors play a part, they just don't account for the entire gap. Something else was going on.
Of course, no study is absolutely perfect, and the researchers were very open about their limitations. For instance, the data they used could have inaccuracies in its coding, and they found that the information on smoking was particularly unreliable.
So the real takeaway here is that this isn't just about the patient's health. That unexplained gap, it really points towards the possibility that the healthcare system itself is operating differently in different parts of the country. And that leaves us with this final, really provocative question that the data alone just can't answer. Now, if you were ever asked about this study, the safe consultant answer would be this. It was a landmark study that showed a clear north-south divide in amputation rates. And that divide was not fully explained by patient demographics or diseases, which strongly suggests that variations in how healthcare is delivered and organized likely play a significant role.